In case you haven't heard, it's open enrollment for the New Gen Holdings Employee Benefits Program. Employees of New Gen Holdings and all of its affiliated companies should review the benefits and make their elections during open enrollment for the new year. If you want to make changes, or even if you don't, you need to go on the e-system and make sure you complete your enrollment. It's a period of time during open enrollment when you can change benefits without questions. Otherwise, you need to have a qualifying event during the year to make changes. So this is the time you can make those a lot easier. No changes in the carriers. MetLife is still going to offer the life and dental and vision and disability plans, and Blue Cross is going to be the carrier for your medical options. Ease will continue to be the system for online enrollment. So that's where you'll go to make the changes you might need, and even if you don't want to make changes, like I said, log into Ease, make sure you got the right beneficiary named, and we'll be completing open enrollment here on December 2nd. Any changes you make are effective on January 1, and remember, dental, vision, and medical are tax-free too if you elect them out of your paycheck. Life insurance is provided to you at no cost. The company provides each and every eligible employee on your original effective date coverage of $20,000 in group term life benefits. Name your beneficiary, make sure that that's the person you want to receive these proceeds in the event of your passing, and make sure you remember to tell them, because just because you're not paying for it doesn't mean it's not important. Voluntary life can be elected if you would like to have more life insurance than the amount provided by your employer. Increments of $10,000 up to $500,000. If you didn't elect it when you renew and first enrolling, you might have to answer health questions over $10,000 elections. If you elect it, you can elect some for your spouse and children, and spouses might also be subject to evidence of insurability or health questions if the amount is larger than the guarantee issue at the time you elect. Dental plans, high and low. High plan is more expensive, but it has better benefits, including an orthodontic plan or portion that covers 50% up to $1,500. If you're using a MetLife orthodontist, you'll have that benefit. Both plans have a rollover. You have your preventive exam at minimum and don't use your maximum. A portion of that maximum will roll over and increase it in subsequent years. Deductible is a little lower on the high plan and just a little bit better coverage other than preventative. Both plans provide that twice a year, 100% with a MetLife dentist for your teeth cleanings and x-rays and fluoride treatments. The vision plan is pretty straightforward. Also with MetLife, $10 for your annual exam, $20 for materials if you need to get new corrective lenses for your glasses. You can get new frames every year too. Spend up to $150, and that's covered by MetLife. And if you want more expensive, you just pay the difference, and they'll discount that more expensive pair of glassware frames for you as well. Contacts are also available if you would rather not have glasses. Same allowance, $150. Just a little bit higher copay when you get contacts, $39. The disability plans are meant to cover income. The company provides a short-term plan for you that'll pay benefits after 7 days. On the 8th day, it'll start calculating. It's going to go up to $1,500 a week, but the limit is to only 60% of your income can be paid by the plan. And the short-term plan will cover you for about 6 months. That's when the short or long-term plan would come into play right at the end of that if you elect it. So you have short-term paid for by the company. Just elect long-term based on the pricing you see in the system when you go enroll. It'll be based on your age and your income. That long-term plan can cover you as long as to age 65 or normal retirement age based on the Social Security guidelines. If you're disabled longer than that, Social Security will pick up and take care of you. All you need is a doctor indicating that you're unable to work based on an illness or injury, and as long as they're verifying that inability, the plans will pay benefits up to the amounts that I described. Important to pick providers that are in the MetLife networks for dental and vision. If you've ever experienced a claim with an out-of-network provider, you know that that'll cost quite a bit of money. There's no discounts that apply, and there could be balance billing that can be fairly significant even with these types of coverage. You can look up benefits either by registering in My Benefits so it knows your plan and network, or you can go in there and not register and still look up providers at the MetLife site. Make sure if you're not signing up for My Benefits that you know your dental is a PDP Plus network and your vision plan, of course, uses VSP. Please let the providers know when you're setting appointments that you're with MetLife. You're not with VSP, although you use that network through this plan. So that'll be confusing for them. They won't be able to verify benefits. So MetLife, that's who your vision plan's with. The medical plan options did reduce. It's believed that these less choices will make it easier for you to select a plan. There are more differential plans, and the high-low PPO plan options are almost identical to what you've had in the past. These are the plans that provide copays for office visits and so forth, and deductibles for larger type claims. The third plan is a high deductible health plan, pretty distinctly unique because it allows you to have a health savings account. That's a bank account, belongs to you, and has tax-free spending abilities and savings that roll over if you don't spend them. All plans use the same network. All plans are open access, and all plans cover the same conditions and treatments for all medically necessary treatment that could be provided by the provider community. So they're all identical when it comes to those major parts. The difference is in the cost sharing. So let's take a look at that kind of side-by-side exhibit. Pretty busy. You can tell here that the PPO plans have copays for office visits, urgent care, and at least the high plan has a copay for emergency room. The drug benefits are a little bit higher than they were with our prior plans, but remember this, protect your cash flow. If you have a large claim, you're going to have a deductible in play, and you could pay as much as the out-of-pocket maximums in the year listed here. After that, the plans cover 100%, and note that wellness or preventative visits, an annual exam is 100%. No out-of-pocket for you on those preventative exams, so go get your well check. Make sure you're doing okay and don't need healthcare services. The third plan is a high deductible health plan. The benefit of this is that you do have insurance, covers all the same things. Difference is you don't have copays. It gets discounted, of course, and applied to the deductible first. So that $3,500 deductible, that's what you would tend to pay on expenses if you incur them, but you can use your bank account to pay those tax-free. It covers 90% after that. You incur another $1,500 a year at 100%, just like the PPO plan. So very different plans. Choices should be a little easier. And in general, if you don't use healthcare as much, you don't want to get a high plan and pay a lot. You'll want to probably start with a low plan. And if something starts to occur to you that you might use the plan, you can always buy up to the high plan at open enrollment. But if you like to save money tax-free, then you've got a health plan that will allow you to do that. The high deductible health plan also covers a lot of maintenance medications at 100%. So there's a list out there somewhere, I think on the Ease system. But if you want to know if your maintenance medication can be changed to something on that list so you don't have to pay for it, just check with your physician once you get the list in your hands. We're happy to provide that to you upon request. Prescription mail order. What we looked at in the data is that a lot of people on maintenance medications and not a lot of people are taking advantage of the mail order program. Less expensive to you, you get a larger supply of your medications and conveniently delivered to your home. A couple of quick clicks on the website and you can change over to mail order. If you're interested in doing this, there should be a flyer in the document section of Ease that explains the steps to take. Just a visual image for you to understand the concept of the high deductible health plan, that third option. It does have a bank account, like I said. Health Equity is the bank that's used by Dugen for the banking arrangements. It's open for you automatically. You'll have to decide whether you want payroll deductions to go and make deposits in there, tax-free, but accumulating the funds is easy. If you start putting some in and you don't use it, it just starts rolling over and the balance builds. If you need it for healthcare, then of course you can spend it on that and some other things tax-free. But two things, bank card and an insurance card. So a little bit different animal here, but if you pay attention to the plan and how you're using it, it certainly can benefit from a high deductible health plan with a health savings account. What can you spend the money on tax-free? Out of pocket on the medical, of course, any cost sharing you're incurring doesn't even have to be a covered expense by the medical plan because it can cover drugstore expenses like cough medicine, dental and vision. Anything you spend when you seek out that type of service is tax-free out of this account. And also any expenses out of pocket for dental, vision, medical for your immediate family member are also tax-free to you. The IRS sets some limits. You can see down in the right-hand corner. It's up to over $4,000 for individual coverage and over $8,000 for family coverage. And you don't have to put money in. Those are just the maximum amounts you can. Your Visa debit card makes it convenient and easy. Like any other Visa debit card, you can write that number down on the bill when you get it, as long as you understand from the insurance company what you owe. Don't pay anything up front, just like you shouldn't with any other plan. Wait till it's processed and you'll pay the balance due. And don't ever pay the discount that's given to you by taken from the claim on an in-network physician. It's not due, and that's really the major part of the plan. Network search on medical is important. azblue.com. You can register there at MyBlue, and I'll know all the plans you have and the network you're using. A lot more intuitive that way, and you don't have to remember a lot. But if you don't join up for MyBlue, you just go in, say you're insured to a employer's plan, make sure you pick the statewide national PPO network, and your zip code. It'll give you physicians of the type you asked for within your zip code area. Just pick a provider from that list. Sometimes you're not really as aware, and they're being scheduled for you on a surgery, for instance. Make sure the anesthesiologist is in network, assistant surgeons, anybody that's going to bill you, you can check and make sure they're in the network. And if you have any difficulty finding those things out or knowing how to look them up, please let us know. We're happy to help because it's very important. It'll save you a lot of heartache and financial problems if you make sure you stay in network. Mobile apps are available. You just have to look for them on the App Store or Google Play. Download the MyBlue application, personal profile by putting your member number in there, and you get your ID card, track your claims, and very easy to do provider searches once you're in that app because it knows what network you're in. Blue Care Anywhere is an app for doing virtual visits. Convenient for primary care and counseling or psychiatric visits or any simple visit where you just need a prescription. A lot of specialist stuff can't be done on there. It's too involved to visit, but download that app and you can do office visits right from your home on your mobile device. I talked about out-of-network claims a little bit, and this slide just goes into it a little bit more, so I won't spend a lot of time, but the in-network provider provides big discounts. The out-of-network provider, they can balance bill you lots of money, whatever they're billing and the insurance company doesn't cover. In-network provider submits your claims, out-of-network provider does not. You can obtain prior authorization for yourself when you use an out-of-network provider. There's not always as adept to do that, but an in-network provider does that prior auth for you. So a lot more convenience and saving money. The point is, I wouldn't be using out-of-network if I could help it. Here's the enrollment process. Same as it's been for the last couple of years. You're going to use EASE, as I mentioned. Get an email, you click on the link, and you just go through the process. Remember that all employees must go through the EASE enrollment process this year because we have a different set of medical plans. We also want to make sure that you update your beneficiaries, and some people have not named one, so please make sure you have that listed for the company-provided basic life insurance. Just the same reminders. Go into EASE, check your designated beneficiary for the life insurance, and complete your enrollment before the first couple of days in December. The site will close on December 2nd. Those employees that haven't taken the time to go through the enrollment process may have jeopardized their coverage for 2024. So please take the time, pay attention to your email, and check your junk files because that EASE email is coming very soon, if not already out there. If you have questions, you're going to contact the Reese Group. Steve and Joanna are always available during open enrollment for sure, and out throughout the year if you have questions and want to make sure the plan's working right for you, especially on that out-of-network utilization or finding in-network providers always. We're happy to help. I look forward to serving you, and thanks for taking some time today.